Hi guys, so today we're going to go through the neural regulation of heart rate via the cardiac control center. So whenever you see the word neural in the question, they'll want you to talk about these three receptors here, what they detect, and then how the cardiac control center uses that information to alter the firing rate of the SA node or to alter heart rate. So let's say it's during exercise, you'd say that the chemoreceptors detect an increase in lactic acid. The proprioceptors detect an increase in movement, and then the baroreceptors detect an increase in blood pressure. And all of that information you'd say is then sent to the cardiac control center in the medulla oblongata in the brain. And then with that information, the cardiac control center would want to increase heart rate. And the way that it would do that is it would send an impulse via the sympathetic nervous system. And in the sympathetic nervous system, you find the accelerator nerve. So you would say that the cardiac control center sends an impulse via the accelerator nerve in the sympathetic nervous system, and this increases the firing rate of the SA node. And then obviously, if it was during recovery, all of these things would be opposite. And then you'd say that the CCC sends an impulse via the parasympathetic nervous system and the vagus nerve, which causes the firing rate of the SA node to reduce. And just make sure that in your answer, you're not saying the word change, you're specifying what that change is.